Mrs. Neutron. I'm Dr. Sarah Bellum, the neurosurgeon. Nice to meet you.
Oh, yes, nice to meet you, doctor.
So, how are you feeling today, Mrs. Neutron? Will Mr. Neutron or anyone else be joining us today?
Um, I'm fine, but of course, I'm just worried about Jimmy. And Mr. Neuron is actually not here because he's on deployment because he works in the Marine, so he's
I see.
not here. But if there's anything, you can just help me.
Alright, I see. So, before we start, can you just tell me what's been going on with Jimmy? Do you have any ideas what could possibly be happening to him right now?
Well, he has been very sick since last Saturday, and he has been throwing up a lot, and he complained of headaches for a week, and he just looks very sick, And I brought him to the nearest hospital, and they, already did some blood tests and hydrated him, like gave him a lot of fluids. That's what they told me. But they think he needs an MRI scan to, just be sure. And I'm worried because mostly because it's flu season and a lot of people have been getting really sick.
Yeah,
Look, it's been gone for 4 hours now, so very
I
worried.
see. So basically, Jimmy has been sick for about a week with headaches and vomiting. And I know that you've waited for a very long time, and I'm very sorry, Mrs. Neutron. But we actually had to sedate him a little bit for the MRI so that he won't be moving around.
I see. Is he okay? Jimmy gets scared very easily.
I see. So he is okay. I saw him right before I came here, actually. And it's basically like him waking up from a long nap. So he's already opened his eyes and moving around, but he's still a bit drowsy. So the nurses are actually watching on him really carefully. So everything's fine.
I see. Okay, that sounds.
So, Mrs. Neutron, I actually looked at his MRI scan, and I'm really sorry, but I'm afraid I have bad news for you. It looks like Jimmy has a brain tumor.
What?
Yeah.
A brain tumor? Are you sure?
Yes. Yes, I have checked the scan really carefully, and it fits all the symptoms that he's been having. So basically, he has a small tumor back here on the cerebellum, which is a part of the brain on the left side. I'm really sorry, Mrs. Neutron.
It's a flu. It's supposed to be a bad flu.
I totally understand the confusion. Sometimes these brain tumors can present this way, with little kids who come with headaches and vomiting, but it's actually the tumor putting pressure on the brain that's causing all these symptoms.
I'm sorry, I'm just really shocked. I didn't know that was a thing.
I know this must be some really hard news for you, and I'm really sorry, and I wish I could have delivered better news.
So is my baby gonna be okay?
He's going to be okay. My team and I will be with you and Jimmy throughout the way. So, Mrs. Neutron, do you mind if I tell you the next step in taking care of your son?
Yeah, sure.
All right. So, I can tell you one thing, Mrs. Neutron. When we look at MRI scans, we can actually tell whether the brain tumors are either the slow growing benign type or the fast growing aggressive types. And the good news is for Jimmy, it looks like it's the slow growing benign tumors, which are less dangerous. Of course, we won't know for sure until we take it out. But to do that, we have to do a surgery, to take the tumor out and to hopefully cure him from his brain tumor.
So we're saying that it's benign?
We hope so. But we'll know for sure once we take it out and look it under the microscope. But from looking at the MRI scan, that would be the more likely scenario.
I see. So it could be just,
Where it's located, it looks like that, yes. So we've looked at the schedule and we would like to admit him by tonight so that tomorrow morning we could start him on medications like steroids to bring down the brain swelling so that he can feel better. And if you're okay with everything, Mrs. Neutron, we can proceed with the surgery on Tuesday morning. And the surgery will only last for around 3 hours.
a couple of days, right? I don't know. He's really the scared type,
Yeah.
Can I see him?
Yes, of course. He's going to be here soon, but the nurses are just getting him ready on the bed. But like I said, he's just waking up from a nap and he'll be around 5 minutes. So I understand, Mrs. Neutron, that this is a lot to take in. But as of now, do you have any questions?
I don't know. I'm just really shocked right now. But how long do you think he's going to be in the hospital after the surgery?
I hope, and most likely things will go well. So he should be able to go home by next weekend. So if he proceeds with the surgery this Tuesday morning, he would be home by Saturday or Sunday.
That's a long time. But he's going to be okay, right?
Of course, Mrs. Neutron. This hospital has a really good neurosurgery team with the best facilities, and we're going to be with him and you every step of the way. And if you like, I can come back later so that we can discuss more when you're able to process all this. And maybe we can go and talk to him together and tell him that he's going to have the brain tumor treated.
Yeah, yes, that would be very helpful. Thank you.
Mrs. Neutron, I know that this is a very hard time for you and Jimmy, but you're not alone in this, and my team and I will be with you throughout the way. We'll take good care of Jimmy. Alright, so take care, Mrs. Neutron. If you have any questions, you can ask me during our meeting later, okay?
Thank you.